Indeed, it's a pleasure to be here this evening with the entire congregation and all who are present. It's my honor to talk to you this evening about cancer, which is quite a wide topic. And without much further ado, I would like to share my slides so that we can go through this presentation. I am aware that some of you will have some questions. You could kindly post them on the chat, or if you're feeling you'd like to post them to me directly, we'll definitely go through the questions at the end of the presentation. All right, so we're talking about cancer, which is such a wide topic, and we decided to pick just on 3 of them. But there's some basic things that one needs to know about cancer when we are talking of cancer. The first thing is that cancer is not a natural phenomenon. It's not something that also is very well understood, despite so much research having been done about cancer. The other thing about cancer is that the basic way in which it happens is that they're the normal cells of an organ, for example, let's say the brain, and then these normal cells undergo very rapid multiplication, and this multiplication results in the formation of abnormal cells. So that's the first thing that is important to note. These abnormal cells, therefore, then after proliferate quite a bit, and they start spreading to other parts of the body, and that's what we call metastasis. So you might hear that word being used here and there, the word metastasis, and that basically means the spread of these cancerous cells from the primary site to the now surrounding areas, to the bloodstream, and then out to distant areas such as the bones and other areas. So the first cancer that we are going to tackle this evening, we're actually going to tackle 3 of them, just in brief, and also in a way that is fairly understandable. So the first one we're going to talk about is cervical cancer. So first of all, of note is that it's the 3rd most common cancer in women worldwide. And then it's a disease that develops quite slowly. And it usually begins with what we call a precancerous condition known as dysplasia. Now, dysplasia basically means the change of cells around the cervix. And I'll show you a diagram in the next slide. So when you have this, what we call dysplastic cells, these dysplastic cells then now keep on undergoing further and further changes. So from becoming just precancerous cells, now they go to the full-blown cancerous cells. Thereafter, now they shift and now start spreading to other surrounding areas in the cervix. So what are we talking about? Now, if I can just use my pointer, this is like this actually is a cross section of the female anatomy. And this here is the uterus. This pear-shaped organ is the uterus. And you can see just below it is the bladder. And then this white area is the pubic bone. And then there's a pad of fat around here. So this area being the uterus, the opening of the uterus is what we call the cervix, this area around here. And this is the area that dilates when a lady is undergoing childbirth. And all this canal down all the way to the opening is the vagina. You can tell that right behind the uterus is this organ here. And this is what we call the rectum. So you can see the close proximity, you can see the close proximity of the cervix to the bladder, to the rectum, to the vagina, and to these other abdominal organs. So it's natural, it's normal to say that if you once having those precancerous changes and then they are not detected early enough, then the next thing is that the cancerous cells form, and the cancerous cells will start immediately to spread to the areas right next to the cervix, which we have elaborated in the diagram. So 90% of all cervical cancers are caused by a virus called the human papilloma virus. And about half of sexually transmitted human papilloma viruses are associated with cervical cancer. So there's usually a common question: is it true that cervical cancer is caused by is a sexually transmitted cancer? And the answer is yes and no, because there are situations whereby somebody might have a human papilloma virus, but it's not sexually transmitted. And then there are also situations where we're not sure what actually caused the lady to get a human papilloma virus. For example, a lady who has never engaged in any sexual activity. So it's good to just have this in mind. However, majority of cases are caused by those sexually transmitted human papilloma virus. So what are some of the risk factors, which is what now we like to emphasize about and also try and educate the public on? So some of the risk factors are, number one, having multiple sexual partners. And this basically because one is therefore more prone to contract HPV, that is a human papilloma virus. It's abbreviated as HPV. Sexual relations before the age of 18. A partner who has had contact with a woman with cervical cancer can lead to the partner, in this case being the male partner, developing penile cancer. Smoking in women, a weak immune system, for example, a system whereby the person is suffering, say, diabetes, HIV, and so on. Several pregnancies, we're talking about pregnancies more than 5. Giving birth at a very young age, that means now the preteen or the teenage mothers. Long-term use of the contraceptive pill because of the high estrogen and progesterone levels, and also a family history. Although this is not very clear, but you tend to see that women who have had, women who suffer from cervical cancer more often than not have a family member who has suffered from some type of cancer or a reproductive area. Some of the signs and symptoms that tend to occur when a lady has cervical cancer are bleeding that occurs between the regular menstrual periods. Now, it's important to note that a normal period is supposed to last between 2 to 7 days. Anything more than 7 days is regarded as abnormal bleeding, and therefore it's a misnomer or it's a wrong thing to say that one is having a prolonged period. Usually any bleeding that is more than 7 days is not a period, but rather is a irregular bleeding. And then the other sign or symptom is bleeding after sexual intercourse. Douching basically means spraying some water or some fluid into the vaginal canal, which is a practice some women use to try and cleanse the area. Or after a pelvic exam, for example, the lady goes to a gynecologist, and after the pelvic exam, the doctor notices that she has started bleeding. The other sign is menstrual periods that are longer and heavier than before. So for example, if a lady was having a menstrual cycle of 2 days, and now it is at 7 days over a very short period of time, then that is a cause for concern. Bleeding going on through even after menopause. We know that menopause usually starts from the age of about 45, usually can last for up to 10 years. However, if a lady continues to have bleeding, either regular or irregular bleeding after menopause, then that is usually a source of concern and needs to be checked. Also, increased vaginal discharge, and usually the discharge that tends to occur usually could be watery, it could have a foul smell, it could also be very thick and unusual, and also pelvic pain. Pelvic pain is not a normal thing to have, and pelvic pain that occurs without any kind of reason, for example, maybe some sporting activity, should always be investigated. Now, some of the investigations are done, and now we have what we call the HPV DNA test, and it's now the gold standard of testing for human papilloma virus. So basically, it's similar to how a pap smear would be done, but this HPV DNA test can actually be done by the lady herself, and it tends to spare the lady I would say the agony or the discomfort of going through a pap smear. And the DNA test is able to check for all types of HPV that could be present in the cervix. Then there's a good old pap smear, which we still recommend for any lady who is sexually active. A CT scan, that is a CAT scan, which is basically a more advanced scan to check the entire pelvic area and any other areas that the doctor or the practitioner might be suspecting that may be having some cancerous cells. An MRI is actually more advanced compared to a CT scan, a pelvic ultrasound, and also examination and anesthesia. I'll just say one or two things about this. Examination and anesthesia is very important because basically what happens is that the lady who is undergoing this examination is first sedated, and the doctor is able to check all the surrounding organs using a very intense microscope. They're able to check and see if there are cancerous cells. They're able to take biopsies, and they're able to see where the cancer has spread. So this is another practice or another investigation that is usually done. So the stages are usually 4. And the stages basically, think about it from the diagram that I showed you at the second slide. So the first stage is cancer, which is confined just to the cervix. The second stage is cancer now, which includes the cervix and the uterus, but hasn't spread to the pelvic wall or to the lower parts of the vagina. And then we have cancer stage 3, which this stage now the cancer has moved beyond the cervix and the uterus. It has gone to the pelvic wall and to the lower wall of the vagina. Stage 4 cancer is cancer which has now spread to the nearby organs. If you remember well, there was the organ, there's the bladder, the rectum behind, the bladder at the front, other areas. Sometimes you might find even metastasis, which is cancerous cells which have spread to the lungs, the liver, and even the bones. Now, the treatment usually depends on the staging of the cancer, the type of HPV that is involved, the age of the woman, and also any other pre-existing conditions. So the first type of treatment would be chemotherapy, which is the use of medication. There's also radiotherapy. Many practitioners actually do start actually with surgery. That should have been the first one. And surgery basically involves removal of any area that might be containing cancerous cells. However, sometimes the lady presents quite late and you find that the cancer or the tumor is too large and first needs to undergo some kind of medication, for example, that is chemotherapy, or needs to undergo radiotherapy for it to shrink. Once it has shrunk, then that is when the practitioner is able to carry out surgery. The surgery may be in the form of laser surgery, or what we call LEAP, which is basically use of electric currents to remove the cells from the mouth of the cervix. Prevention, and this is another good area where we try and sensitize ladies of all ages. Number one is the HPV vaccine. I remember there was quite a bit of controversy when the vaccine was introduced by the government. The HPV vaccine is largely safe, and the thing to note about the HPV vaccine is that ideally it should not be given to, or rather should be given to girls from the age of 9 years and above. Usually we say from the age of 9 to 15. This is because there's that assumption that girls over the age of 15 might be engaging in sexual practices. However, it's important to note that that is not the case. Any woman, so long as she's of childbearing age, can actually get the HPV vaccine. But for any woman who has already, for example, had children or has engaged in any kind of sexual activity, should need to first undergo either a HPV DNA test or a pap smear to first make sure that she does not have any cancerous cells or have any form of HPV that could lead to her getting cancer. And then after that, she can get the vaccine. Then the next thing that we advocate for is safe sex. And safe sex, I like to say, because of partners who are in situations whereby You find, for example, one partner is, for example, I'll go with the case of discordant couples, where one partner, for example, not for example, but actually does have HIV and the other partner is HIV negative. So we do advocate for safe sex between these partners. Because remember, in the earlier slide, we say that partners or a lady who has a reduced immunity is more prone to getting HPV. The cervical screening, that is the use of the HPV DNA test, and also the pap smear, having few sexual partners, and that is also including delaying the sexual debut. I know there's been a lot in our society whereby early sex is glorified, but now we have seen that the repercussions of this early sex and things like this cervical cancer is one of them. So if delaying the first sexual, or rather delaying the first sexual intercourse would cause or would lead to somebody having a lower risk of developing HPV or contracting HPV and thereby getting cervical cancer. And lastly, avoiding smoking. Now we'll go on to the second cancer, and that is breast cancer. Now it's a second leading cause of cancer in women worldwide. And in our Kenyan setup also, there's a large burden. 80% of breast cancer happens in women who are above the age of 50 years. Usually, the way breast cancer has been handled or has been managed has really changed from the 70s to nowadays. Initially in the 70s, when these cases were on the rise, it involved what we call a radical mastectomy. And that's why you might find maybe much older ladies having undergone very intense kind of surgery to remove the breast tissue, the lymph nodes and all. However, nowadays we are trying as best as we can to what we call breast sparing surgeries, and that is maybe removing just the lump only, but I'm getting ahead of myself. I'm going to talk about that in a bit. Now, some of the signs and symptoms usually include a painless lump and thickness of the breast. Usually many women will come to hospital complaining of a lump, which is painful, and more often than not, it's usually non-cancerous. There could be a change in the skin color of the breast, change in the size and the contour of the breast. And these are usually changes that have been noticed either suddenly or even over time. Enlarged lymph nodes in the axilla, that is the armpit, in the neck and in the chest. There could be retraction or indentation of the nipple. I'll show you some pictures in a bit. There could be a discharge from the nipple. It could be a clear discharge, like a watery kind of discharge, or it could be colored. And then now there are also many non-cancerous changes that happen in the breast. And this is where I think as practitioners, we need to really emphasize to women that not all lumps are cancerous. In fact, majority of lumps are non-cancerous. And some of these include what we call fibroadenomas, which are basically fibrous tissue, which just solidifies and forms a lump, and it's usually painful. Infections, especially in breastfeeding mothers. Fibrocystic changes that tend to occur, especially with age. Cysts. Cysts tend to happen from an early age. So you might find a teenage girl presenting with a cyst or even multiple cysts, and then thereafter getting very concerned that they may be having breast cancer. But when we do all the investigations, we find out there are cysts, which are basically pockets of fluid within the breast tissue. And even injuries. Think about ladies who play sports that might involve some bit of injury, say like contact sports. Injuries would also cause a lump or a swelling or a change in the contour of the breast, and should always be investigated appropriately. So when we're talking about all these things, this is a diagram to show you what we mean. So you have the nipple, you have the nipple right here, and you can see these are the ducts, these are the milk glands or the lobes, and then these are the lymph nodes and the vessels. So you can see these round green illustrations are the lymph nodes, the lymph ducts, and then they go all the way to the breast tissue. Then just below the breast, you can see this large muscle here. This is called the pectoralis muscle. Now, there are some times when this muscle could be very painful or tender. For example, even when one has an infection such as a pneumonia, and a lady will come presenting with breast pain because you can see the breast lies right on top of the pectoralis muscle. So it's important to also differentiate where the pain is coming from. Is it coming from, where's my, sorry about that. It's important to differentiate whether the pain is coming from the breast tissue or from the pectoralis muscle. Now the types are so different and they're so varied. So again, this is a simple illustration of the breast tissue. So let's say, for example, the lump is here. It could be coming from the lobes, and that's what we call lobular breast cancer. It could be coming from the mucous membranes around the breast tissue. That's what we call mucinous breast cancer. It could be an inflammatory breast cancer, whereby you have inflammation of the entire breast area. So it's called inflammatory breast cancer. It could also be a mixed tumor. So you have different types of cancers. It could be from the lobes, from the ducts. We call it a mixed tumor breast cancer. It could also be a ductal breast cancer. Now the causes are largely unknown, but however, 5 to 10% of breast cancers are inherited, and the common genes are BRCA1 and BRCA2. Now, somebody who has BRCA2 has a higher chance of getting ovarian cancer as well. Also, exposure to radiation at an early age has been shown to cause breast cancer. The risk factors, we like to classify them as modifiable and non-modifiable. The non-modifiable means that they can't be changed. So the age, the family history of cancer, especially if the family, or rather if the lady has maternal aunties or relatives who have breast cancer, radiation exposure as well. The modifiable risk factors, and that's what we emphasize on, is things like excessive weight. These are now things that one can do something about. The use of hormonal contraception because of having that prolonged use of estrogen in the system. So that is what could lead to breast cancer. Smoking, excessive consumption of alcohol, early onset of a menstrual cycle, that is before the age of 12, late menopause, that is past the age of 55 years, race, white or Caucasian women are more prone to getting breast cancer. Any kind of hormonal therapy for whatever reason could also lead to breast cancer. Precancerous breast changes like the ones we mentioned earlier, and that's why they need to be investigated because some have been shown to end up causing cancerous cells being formed. And also increased breast density. Increased breast density is because of now having a lot of fibrous tissue in the breast that could end up causing cancerous changes. And it's important that women get screened, especially women who have very heavily dense breasts. It's important that they get screened regularly. And we'll talk about the screening next. So the diagnosis of breast cancer, the first thing is really what we call the self-breast examination. And this has saved so many women from doom, I would say. Then usually after that, once a lady, for example, presents to the emergency room complaining of a lump and she examines it and she says she found a lump, the doctor will also do an examination, then send her for a breast ultrasound and a mammogram, depending on her age. By and large, we don't do mammogram for any lady above the age of, below the age of 40 years. And there's also computer-aided diagnosis where you use a computer just to check and see. An MRI, a CT scan. Any lump in the breast has to undergo what we call fine needle aspiration. And if the lump is able to be removed, then we do a biopsy and remove it all together. And then we also do tests called estrogen and progesterone receptor tests, because remember I told you there was that influence of the hormones causing breast cancer. So we do these estrogen and progesterone tests to see how high the hormone levels might be. The treatment, again, is tailor-made depending on staging. And we have, again, stage 1 to stage 4. Because of timing, I'm not going to go through all the stages. But now the treatment is tailor-made depending on the stage, and it involves chemotherapy, radiotherapy, surgery. The surgery can be, we like to have breast sparing surgery. But however, if the tumor has spread too radically, then we do the radical mastectomy. But now there's also the breast sparing ones, which could be partial or segmental, where we just remove the area that is affected. We could also remove, we do a sentinel node biopsy, which basically means that we remove some of the nodes around the breast area, and also an axillary lymph node dissection to make sure that this breast cancer does not recur. And then last but not least, but also so important for many women, is reconstructive surgery to try and restore the breast area to what it was before. Prevention basically would involve preventive surgery. Preventive surgery is mostly done by women who have a high risk of developing breast cancer. We also have what we call a prophylactic oophorectomy. I know it's a long name, but basically what it means is that we remove the ovaries, because remember, any lady who has BRCA2 gene is likely to develop ovarian cancer. So sometimes the doctor might recommend that the ovaries are removed to prevent them from getting cancer later. Chemo prevention basically is the use of medication to prevent the cancer from recurring. The use of tamoxifen, you might have heard the term tamoxifen, or the name of the drug tamoxifen. That is the commonly used drug here. And then a prophylactic mastectomy. So for ladies who are at high risk, some ladies do choose to have a mastectomy just to prevent them from having to maybe deal with a situation of breast cancer later. And also lifestyle modification for those things that can be modified. Last but not least, we'll touch a bit on prostate cancer. Now the prostate, let me take you right away to a diagram. And now this is a cross-section of the male anatomy. The prostate is this gland that you see over here, and you can see it's in 3 parts. If you zoom in further, you'll see that it's made up of 3 layers. Actually, there's a zoom in right here. So, for example, this is a cancerous tumor. This outer layer is the commonest layer where prostate cancer tends to occur. To take you back to this diagram, you can see that these are what we call the seminal vesicles, which are basically vesicles that would cause, or rather that bring around the fluid that causes, that contributes rather to semen. You can see the bladder is right up here. The rectum is right at the back. And then now this is the urethra. The urethra goes all the way down through the penis. And then there's the scrotal tissue down here. So if you're talking of spread of this prostate cancer, then you can see the organs that it's likely to spread to and why it spreads to these organs so quickly. Some of the symptoms that men tend to experience when they have prostate cancer are trouble urinating. When I talk of trouble urinating, basically that means any change in the pattern. So from urinating several times in a day, or urinating fewer times in the day, passing urine where there's a decreased force of urine in the urine stream, blood in the urine or blood in the semen, cloudy semen, bone pain, and erectile dysfunction. Now, the cause is largely unknown, and that's a sad fact. There are some theories that men who have maybe had the causes of prostate cancer are largely unknown, but basically the cells in the peripheral region tend to start undergoing cancerous changes, and these are usually because of changes to the cell's DNA. Then now these cancerous cells spread to the surrounding structures, eventually to the bloodstream and other parts of the body. Some of the risk factors would include, the next one, please.
Sorry.
The next slide, please. Yes. So some of the risk factors are any man above the age of 50, any man of the Black race, obesity, as well as a family history of prostate cancer. Next. The diagnosis is a bit controversial. This is mostly because of the kind of examinations that are involved. However, usually we start with what we call a PSA, or a prostate-specific antigen test, which is a simple blood test. And this usually is brought around when a man complains of symptoms which could be suggestive of prostate cancer. And then after that, if the PSA is seen to be high, then the next examination would be a digital rectal examination by a doctor. Then a prostate ultrasound to check the size of the prostate gland. MRI in case the tests do turn out that the man is suffering from cancer of the prostate. A prostate biopsy to determine the exact type of prostate cancer that is going on, a bone scan, and a PET scan. The treatment also is tailor-made to the type of prostate cancer, or rather the extent to which the prostate cancer has spread. So if the cancer is just within the prostate gland and has not spread much, then surgery is usually done, which is a simple surgery just to remove the prostate gland. Thereafter, the patient is subjected to radiation to ensure that the cancerous cells are completely eliminated. There's also a technology whereby where there is freezing or heating of the prostate tissue to kill the DNA within the cells. There's also hormone therapy, and this is usually carried out especially in cases where the prostate cancer has spread quite a bit. And this is usually done to reduce testosterone production. Remember that prostate cancer is usually fueled by testosterone, which is the primary hormone in men. So some of these treatments, though radical, are usually intended to heal or to ensure that the cancer goes into remission. There's also orchidectomy, which is removal of the testicles, which are the organs that produce testosterone. Then there's chemotherapy and also immunotherapy, which is medication to remove, to take care of the cancerous tissue. So with those many things tried to be compressed in one, I hope you managed to gather something, and thank you so much for your attention. I genuinely appreciate it. And now I'll be happy to take any questions.
Awesome. Thank you, Daktari. We have quite a number of questions.
All right.
Yes, and I'll read some of them. Actually, because we have a few minutes, we can do all of them, depending on the way you will respond to them.
Okay.
Yes, and the first question this evening is, question number one is, what duration do you consider long-term use of contraceptive?
Long-term use of contraceptive is anything more than 10 years. And that is the hormonal contraceptives, which are not limited to the pill, the patches, the Depo-Provera, anything that would involve hormones. So use of those contraceptives for more than 10 years, 10 years continuously is considered long-term use.
Good, thank you. Thank you, Daktari. I believe the question is well handled. Number two, we have a question that is asking, why do cancer patients' conditions seem to worsen once chemotherapy treatment is introduced?
I believe it is because of the toxicity, and I say toxicity in quotes, of the chemotherapeutic medicine that is used. Remember, this medication is injected into the bloodstream with the aim of killing the cancerous cells. However, as it's killing these cancerous cells, it's also causing, changes to other cells in the body, the healthy cells of the body. And what tends to happen is that the side effects of the chemotherapy does make a patient worse. However, we've also seen situations whereby a patient whose cancer symptoms did not seem so severe, now the cancer symptoms seem even worse, but I believe it is because of the side effects that are being caused by the chemotherapy medicines.
Thank you, Dr. Okay, the other question is, how available is the HPV vaccine?
The HPV vaccine is available for free for girls under the age of 12 years in all government facilities. In private facilities, it is usually paid for because they also don't get it for free. And the HPV vaccine usually is done in 3 doses. So I believe that 1 dose goes for between 5,000 to 7,000. So if you're talking of 3 doses, you're talking about around 20,000, 21,000. That is usually the cost to the patient. But for girls under the age of 12, it's free in government facilities.
Okay, thank you, Dr. We have many questions. We have another one here. What does brachytherapy entail? And under the same question, can you administer chemotherapy the same day with brachytherapy?
Well, brachytherapy is a more advanced way of treating cancer. It involves the use of certain rays. We didn't have brachytherapy until not long ago, but I believe now it's available at one facility here in Nairobi. And I'm not very familiar with whether it is wise to administer it together with chemotherapy just because of the side effects. Usually it's the oncologists who would make that call on whether they would want to administer it together with chemotherapy.
Okay, thank you, Dr. Another question, are calcium calcifications cancerous?
Not necessarily. It depends on where they are found and in what context we are talking about them. If you can have calcifications, that's basically, in this case, I believe the person needs to ask calcium calcifications. You can have them depositing, for example, in the breast or it's any kind of soft tissue, and it's usually because of an overload of calcium in the body. But however, if we're talking of a patient who already has been diagnosed with cancer and now they're having calcium calcifications in, for example, the bones or in other areas such as the brain, then in that case, then they would be quite harmful.
Thank you. Another question on calcification. Another question on calcification. Can calcification in the breast lead to breast cancer?
I think first it would be good to find out where these calcifications occurring. I don't want to give a blanket statement and say yes or no. I think it would be more prudent to first find out where the person is getting these calcifications, what is the key, the core of these calcifications, and then from there, a more proper answer would be able to be given.
Good. Another question. Can cancer heal and later come back after several years, maybe causing organs failure, e.g. liver?
Well, with cancer, we don't say that the cancer has healed. I know there's a bit of controversy there, but usually medically speaking, we say that the cancer is in remission, meaning that there are no cancerous cells at all being found in the body after a PET scan has been done, and that the person does not have any signs or symptoms suggestive of cancer. In this case, we say the cancer is in remission, but it has not healed. It means that the cancer, there's still a percentage that the cancer could return, and actually could return even worse than it was in the first place. But it is true that there are patients who go through the cancer battle. They go into remission and never get out of remission. They remain cancer-free for the rest of their lives. So medically speaking, I would say remission is the term that we tend to use rather than cure.
Thank you, Daktari. Another one is, please briefly comment on cancer stages 1 to 4.
All right, that's quite a broad question, and I don't know which cancer in particular the person had in mind, but when you think of the cancer stages 1 to 4, basically, let me give you the example of cervical cancer, or let's even talk about breast cancer because I didn't mention the stages. So when we talk of breast cancer stage 1, that is cancer which is just located in the breast tissue alone. Breast cancer stage 2 is cancer which has now spread to the lymph nodes. If you remember the diagram earlier, for some lymph nodes in the axilla, around the neck. Then we have breast cancer stage 3, and this is now cancer which has spread to the surrounding organs. Now the muscle which was beneath the breast tissue, the lungs, and also just the surrounding structures around the chest. Stage 4 now is what we call metastatic disease, or now advanced cancer, whereby now the cancer has spread all over the body to distant areas such as the bones, the brain, any organ, the liver, the kidneys. That's how I would classify the staging of cancer. So it's from the very primary source to all over the body. So from stage 1 usually until stage 4.
Awesome. Another question is, why do cancer patients always prefer treatment out of the country, and yet we have qualified doctors like you?
Thank you very much for the compliment. The person who has said that, I really do appreciate that. And it's true, you know, what happened in the past is that cancer treatment was extremely expensive. It wasn't covered by NHIF. The facilities that offered treatment were very few. The specialists were few, you know, but I think as we have grown as the medical fraternity, now cancer treatment is, I would say, almost affordable to many people, mostly because it's covered quite a bit by NHIF. Secondly, we now have the expertise. We have specialists who are trained locally to even handle cancer cases that are unique here in Kenya. We also have now the machines, like I mentioned, we recently got a brachytherapy machine here in Kenya, something we didn't have for the longest time. We have PET scans in a number of hospitals. So I think the way it's being handled is much better. The cost of medication is going down, but we still have a bit of way to go. And I think also we still need to build the trust of the wananchi that we know what we are doing and we are trying our best.
Good. The questions are many and time is quite flying. Thank you, Daktari. 2 more questions for HPV. Is the HPV vaccine safe for our girls? Then somebody else is asking, is HPV treatable?
Okay. So my personal opinion is that HPV is a very safe vaccine. A lot of trials were done before it was rolled out. I know there was quite a bit of controversy, mostly from, I would say, the Christian fraternity about it maybe having certain elements in the vaccine that could be unsafe, but those have not been proven. There are people who still feel uneasy about taking the vaccine. And I usually tell my clients, I think you leave it to your conscience what you want to do about whether you want to vaccinate your daughter or not. But by and large, the vaccine that is used here in Kenya is the same one that is used in the US or in Britain. There's no difference about it. Then the second question is whether HPV is treatable. By and large, it is. There are some strains of HPV that I would say are mild. And if detected through that test, we call the HPV DNA test, then the person goes through antiviral treatment because HPV is a virus. And then after that, they do another HPV DNA test, and more often than not, you find that it has been cured. But however, if it's found late and it's very aggressive, then many times the treatment might even involve removing the cervix or undertaking some more radical measures to ensure that the virus is completely gone.
Awesome. Thank you. Thank you, Daktari. Maybe two more questions. Then I'll maybe you can take two minutes to answer them. Then we'll be done. So can one have multiple types of cancer at the same time? And the second question is, why is it that when one is declared cancer-free and later the cancer returns, it seems to spread fast and furious?
Yes, it's possible to have more than one type of cancer at the same time, especially if one is, I would say, immunocompromised, meaning that their immune system is compromised, it's low. For example, a person suffering from HIV, diabetes, anything that would cause low immunity. So you find that they have several types of cancers in the body. Although there's also a situation whereby you have a cancer starting from one area and spreading to other areas and causing other types of cancer to develop. So yes, the answer is yes, it's possible to have different cancers at the same time, which becomes a bit of a challenge to treat, but I would say is treatable. The second question was, why is it that when the cancer returns, it's more aggressive? I believe it's because of the mutations or the changes in the cells that have taken place. Remember, cancer is basically the transformation of cells from normal cells to cancerous cells. And many times, for reasons we are not so sure, and I believe because of maybe age, also because of exposure to so many of these chemotherapy agents and radiation and MRI scans and so many things. Now, when the cancer comes back, because of now the body having undergone so much, I would say, traumatic interventions, then the cancer tends to come back much more aggressive, and sadly, many people do succumb that way.